This case series is on patients who have metastatic renal cell cancer with bone metastases. And bone metastases are known to be associated with poorer prognoses than patients who have metastatic renal cell cancer without bone metastases, and with the median survival being about 12 months. One of the treatments that the patients received was Nivolumab and Ipilimumab, which is a combination immune checkpoint inhibitor therapy. Also, they received CVM-588, which is a live biotherapeutic product. And live biotherapeutic products are live microorganisms to treat or prevent disease. And CVM-588 specifically is believed to modulate the gut microbiome and increase the efficacy of immune checkpoint inhibitors. Yeah, so patient 1 had started with localized renal cell carcinoma with clear cell subtype. However, she had bone metastases 18 months later, and so she started on the clinical trial of Nivolumab and Ipilimumab plus or minus CVM-588, which she stayed on for 44 months. And she's been off of the treatment for over a year now and has maintained a deep and durable response. And patient 2 had de novo metastatic renal cell carcinoma. She was on the treatment for 15 months, but she had grade 3 arthritis, and so she had to stop the Nivo-Ipi and actually went on just CVM-588 alone for 20 months after that. And as of now, the patient has been off of treatment altogether for a year and a half and off of Nivo-Ipi for over 3 years now, and has made a very deep and durable response as well. Figure 1 is patient 2's bone scans. And so this is before starting the treatment, and this is afterwards. And you can see in the humerus right here, this is a pretty big lesion. And over here in year 5, there's a very substantial decrease. And also here in the posterior iliac bones and also the sacrum, you can see some notable differences after being off treatment for over a year, about a year and a half. And so the results are pretty significant. This is the clinical trial that the patients were on. And so this first table right here is the treatments that they received. So they were both in this group right here, which is Nivolumab and Ipilimumab for 12 weeks. And then after that, Nivolumab, 480 milligrams every month. And in addition, there was CVM-588, 80 milligrams per day. And the other group was the same treatment, except they did not receive CVM-588. And then this graph down here is about the response rate for the patients. And as you can see in the group that didn't receive CVM-588, the partial response rate was 20%, while in the addition of CVM-588, the partial response rate was 58%. And then you can also see progression-free survival was substantially different, where the group that did not receive CVM-588 had a progression-free survival of 2.5 months, but when CVM-588 was added, this increased to 12.7 months. Since the patients had such a deep and durable response, especially considering they had bone metastases and they'd been off treatment for a while, and even patient 2 was on just CVM-588 alone for 20 months, it shows the potential of the gut microbiome modulation and for live biotherapeutic products to increase efficacy of immune checkpoint inhibitors. It also shows how CVM-588 may have a potential synergistic effect on immune checkpoint inhibitors and potentially decrease primary resistance to immunotherapy. However, larger trials are still warranted to really determine the role of gut microbiome modulation in treating renal cell carcinoma.